In the news this week, classroom kerfuffle, teachers confused as internal emails rejects social distancing.
Plight of nurses, AMAWA President responds to the issues hitting nurses during COVID-19.
A different way of remembering our Anzacs, how WA remembers its fallen soldiers online.
And on Western Perspective, Ramadan under COVID-19. A feature interview with Salim Youssef on how Muslims in WA commemorate in isolation.
This is the Evening News with Ivan Leung and Sarah Smith.
The Department of Education has told public school staffers that social distancing is not necessary in classrooms 1 day before the Prime Minister made the announcement. During the same week, the Teachers' Union called for parents to keep kids at home to make social distancing easier. Helene Fong reports.
Differing interpretations of constantly changing health advice has some teachers frustrated, as the department says schools don't need to social distance. In an internal email obtained by WAMN News, the Director General of the Department of Education told staff that classrooms are able to operate without 1.5 metres of social distancing, a day before the PM announced the same. I know you are concerned about physical distancing between students. All the medical advice I have received tells me that schools are safe and classrooms are capable of being managed without the 1.5 metre rule in place. I know you have been missing your students, as I'm sure they have missed you. I ask that you place your trust in the health advice that has been provided and continue to do the wonderful job you have of educating our children. The Prime Minister cited advice from the Australian Health Protection Principal Committee, but on the same day, a teachers' union cited the same committee, calling for kids to be kept home. Published advice from the committee says that adults are most at risk in schools, but still prescribes general social distancing during learning.
A classroom is a unique environment. It's unique for a couple of reasons. One, because it's a workplace, but also we know that children play a reduced role in terms of any community-based transmission. So the viral load on children tends to be lower, and as a result of that, the risk of transmission amongst children is very low indeed.
Health experts say that the risk was reasonable, but parents should make the final call.
Give them that piece of information and say, are you comfortable to proceed? I think that's the empathetic thing to do.
Helene Fong, WAMN News.
Meanwhile, in other stories, Premier Mark McGowan has announced the state's relaxation of rules in both indoor and outdoor gatherings to 10 people or less. There are also no new COVID-19 cases recorded on Sunday. The state government stressed that gathering sizes are cautiously relaxed based on expert health advice.
The Australian Medical Association in WA has responded to the plight facing nurses, with President Dr. Andrew Miller telling of a dehumanisation and a lack of empathy in the medical workforce. Following our story last week, Dr. Miller says there's a big problem with culture and a need for better communication between government and nurses. He talked to us this week in an exclusive interview.
A WA nurse has demanded the government's executive level to listen to them and give them a chance to ask questions directly. Does this show that there has not been an adequate communications between the frontline staffers and the executive level?
Look, I think the government have had a difficult task, but it's really important that they connect well with the frontline of all of the workers, including the nurses. There's been a particular difficulty that's grown up because many nurses have casual employment or part-time employment, and during this period of time when there's been reduced activity in the private and the public hospitals, a lot of them have lost work, and so they have been unable to be connected with a workplace, and at the same time they haven't been able to ask questions of government.
Political expert Dr. Ian Cook says that the story that we broadcasted last week shows that there is not enough forward planning, and at the same time exposed the fact that nurses have suffered a track record of underappreciation and under-respect. Was that the case?
Well, I certainly think that there has been reduction in resource going to the front line for many years. We know that the ambulance ramping and so on has been occurring for some time, showing that there's a reduction in service there. I think that the workplace has become depersonalised to some degree. There's less team building. There's not much measurement of the consistency and coherence of teams, who's part of them. And we find that the best workplaces within hospitals are those where leaders arise who are good at creating and holding on to those teams, in some cases despite the sort of management structure that's around them. There's a big problem with culture, particularly in our public hospitals. There's a lot of disengagement, there's a lot of burnout that's been measured in both government and non-government surveys, and part of that has been the dehumanisation, the lack of empathy of the system, and continual rounds of budget cuts over the years which have essentially chopped all the fat out of it and leave people working through their meal breaks, working extra hours, needing to do mandatory module and on-the-job training in their spare time. And that leads in the end to people becoming disillusioned.
Moving forward, will there be any opportunities for frontline health workers to directly express their concerns to the executives?
Well, that's going to be up to the people who run the health system as to whether they're able to incorporate that truly into their culture. Certainly there are surveys that go out that then get reported on, but you can understand that managers of systems want to show their performance in a good light. So whether or not that translates into a change in experience for the people on the front line, you then have to ask them. There's professional surveys of things like Press Ganey, third-party surveys, which are quite objective, which can be done to see if these organisations really are engaging properly with their staff in a way that people in private enterprise know that they have to do. Otherwise, their business can't be successful.
And the Health Department has responded to our questions in a statement. It says nurses and midwives are a highly valued workforce who are very well respected for their expertise and the work they do in caring for our patients and the WA community. There is no evidence to suggest that nurses in Western Australia are systematically under-respected or underpaid. Nurses who are employed by health services will be paid for training that they undertake. Those nurses who are unemployed will be afforded the same training if they enter the workforce and are involved in the delivery of care to patients and the WA community. The statement also says all health workers are also welcome to voice any concerns directly with either their line managers or executive staff. And you can read the full statement from the department on a website at wamnnews.com.au.
This year's Anzac Day proves that not even a pandemic can dampen the Anzac spirit. Thousands of families gathered in their driveways with others in their street to remember the sacrifice of the Anzac soldiers.
Many participated in online Anzac services held by local RSLs. RSL WA CEO John McCourt says that although they were a bit different, the Anzac Day commemorations this year were just as meaningful as ever. Meanwhile, 95-year-old World War II veteran Kevin Jones commemorated Anzac Day at his driveway at 6 a.m. in the morning. The social distancing measure in place did not deter neighbours from joining him in solidarity, with the man giving him a six-pack of beer during our live interview.
How do you plan to spend the rest of your day?
Quietly as possible.
Six-pack for you, Kevin. Have a drink on me, mate. Six-pack for you.
Oh, thank you, yeah.
Cheers. This is amazing.
Yeah, it is amazing. It's just, every year seems to get bigger regardless of the virus. It gets bigger than the year before.
Hand sanitiser in WA hospitals is set to increase following a state government commitment to improve supplies in the state that were lessened by COVID-19. Wild Child Laboratories will meet the government's $1.7 million order to produce and deliver 200,000 bottles to WA hospitals for the year. This will boost supplies for 40 weeks. It's designed to reduce reliance on overseas supply and boost local industry in response to the coronavirus pandemic.
By securing this contract here today, it means that Wild Child can continue to employ people out here in Malaga, can continue to grow their business, and it means that as a community we are more resilient when it comes to our medical supply chains.
The Health Minister took a guided tour of the new contact tracing office this week, inspecting the team that works 7 days a week to contain the spread of COVID-19. When a COVID-19 test comes back positive, it's the contact tracing team's job to let the patient know and get in touch with anyone who may have been exposed. Clinical lead Dr. Ben Scully says the team won't be able to relax until there's a vaccine.
This is a time when we need to consolidate and train a workforce because it's not over, it's just the numbers have gone down and we need to be ready for when there's future cases.
Free-flowing traffic and productivity will improve in the state, with NorthLINK WA now fully open to the public. The $1.2 billion project will transform how the traffic moves from WA's north, while doubling road capacity, taking trucks off local roads, reducing travel times and improving safety. The government says that it's a game changer for the state's roads.
I think what's great is that not even a pandemic has managed to stop this project. On time, on budget, the single biggest project in WA's road history, and what a difference it's going to make.
We will see thousands of trucks taken off the Great Northern Highway onto this more direct route. So significant time savings for everyone across the freight industry.
The United States have confirmed that 2 people have died of COVID-19 back in the beginning of February, which is weeks ahead of the first official announcement. Medical experts who are looking into the matter believe the disease was already spreading in the United States since January this year, with the possibility that the death toll could be higher than 45,000 people. Some authorities in America's West Coast are expecting to discover older cases of coronavirus. Meanwhile, in Britain, UK's chief health officer warned that it will be months before social distancing measures will be relaxed in an attempt to tackle the coronavirus. He says until a drug or vaccine has been successfully produced, which isn't likely in the next calendar year, other social distancing measures need to be in place. The Johnson government is under pressure to relax lockdown measures, despite the country's death toll has exceeded 18,000 this week.
A small family business has stepped up during coronavirus to bring food to people in need. Gabriela Lizea is helping her parents, Mariela Martinez and Arturo Lizea, to run Mama Elsa, a Latin food delivery business that has been distributing free meals to international students in need. Mariela and Gabriela say that it's hard to find genuine Latin food in WA. The business has big plans to expand and bring their experience to new people.
Because of the coronavirus, just because people can't go to restaurants and access this food, so we decided that it was more important to try and reach places, especially people that can't go for being, isolated. It's a way of sharing our culture and trying to help out at the same time.
And that's our weekly news and current affairs. We have the latest news on our website and social media pages.
Until 5:30 next Sunday, look after yourself, stay at home and have a pleasant evening.
Take care.